Hello, I'm Dr. Vicky Cleak, a consultant general adult psychiatrist. Many of us feel low from time to time, but how do we know when sadness becomes something more serious, something that may need professional help or even antidepressant medication? Well, in this video, we'll look at how to tell the difference between sadness, adjustment, and clinical depression, and why recognizing depression early really matters. Sadness is a healthy human emotion. It's the flip side to being able to experience happiness, and you can't have one without the other. Sadness tells us that something is painful or something disappointing has happened. Usually it comes and goes or fades over a short period of time, and we're still able to find moments of joy or connection with others. Depression, by contrast, is an illness. It affects not only mood, but energy, motivation, takes away and distorts any positive thoughts of ourselves or the world around us, and it disrupts our normal biological functions such as sleep and appetite. It also takes away our ability to experience any pleasure, so our sex drive may also be affected. The sadness becomes constant, and daily life and even thinking can feel like wading through treacle. After a major life event such as bereavement, divorce, or losing a job, it's completely natural to feel low or anxious. We call this an adjustment reaction. In grief, emotions often come in waves. Sadness interspersed with moments where we can remember the loved one with warmth. Clinical depression, however, feels very different. The low mood becomes fairly continuous with no respite. You get a kiss from your grandchild or win the lottery and not actually care. It erodes away your motivation, leading to social withdrawal and a drop in your own self-care, which can lead to more shame and guilt. Depression doesn't always look like sadness. In older adults, it can develop gradually and may be mistaken for tiredness, memory problems, or simply slowing down with old age. In men, depression often shows up as irritability, anger, or withdrawal rather than being tearful. And for introverts who already value time alone, it may take loved ones a little while to notice how isolated or disengaged that they've become. This insidious onset means that depression can creep in quietly, especially when people keep pushing through or telling themselves to just get on with it. But untreated depression can become as serious as any physical illness, sometimes even life-threatening, and rarely psychotic, with the onset of hearing voices or believing you've done something terrible and deserve to die. If this happens, then you definitely need extra help and support, and it's a sign of very severe depression, which may need more than just antidepressants alone to get better. Depression is not a weakness or a personality flaw. It's a medical illness that affects the brain and the body. Just as pneumonia affects the lungs or diabetes affects insulin levels, depression affects the way that the brain regulates your mood and energy, as well as motivation. Left untreated, it can have consequences every bit as serious as a physical illness, including, tragically, loss of life through suicide, and rarely through hurting others in the belief that you're protecting them. Sadly, stigma and shame still stop many people from seeking help. Externally, society often sends that message that we should just toughen up, and internally, people blame themselves. They feel weak for struggling and guilty for not getting on with things. But depression isn't a character flaw. It's a real illness that deserves compassion and treatment, just like heart disease or cancer. Acknowledging this and asking for help is not a sign of weakness. It's actually a sign of strength and courage. Recovery is absolutely possible. Antidepressant medication can be very effective, especially for moderate to severe depression. I know that there's lots of negative information out there about side effects of antidepressants, but the good thing is that not everyone is bothered by side effects, and sometimes they can be useful in treating or managing something else. There are also lots of different medications with different side effects, so you can work with your doctor to find one that suits. Just be honest with them and keep a note of any changes you notice, as it's usually really easy to sort this out. Nobody wants you to suffer in silence. Medication is just one part of treatment. Therapy like CBT, cognitive behavioural therapy, helps you to challenge unhelpful thoughts and habits, and when used with antidepressants will improve recovery rate significantly. Exercise and time outdoors improve your mood and sleep. Keeping an activity or mood diary helps you to see progress and focus on the positive, because we know that even small wins matter when you're depressed. And there are some exciting additional new treatment options being made available to people, such as neuromodulation, an example being flow. These can be used an adjunct to go alongside therapy or medication or instead of. If you've been feeling persistently low or unsure whether antidepressants might help, then seeing a psychiatrist can be a crucial step. Psychiatrists can rule out any medical causes of your low mood and any other conditions that might be interfering with recovery or triggering the depression, such as heavy use of alcohol and ADHD. They can assess the type and severity of depression and create a tailored plan with you, combining therapy, medication and lifestyle support. Remember, depression is a common, treatable, and recovery starts with reaching out. If this video resonated with you, please speak to your GP or mental health professional. Thank you very much for watching.